Priyanka Srinivasan presenting you your messy minds. So in this video we are going to see about the illness anxiety disorder. So most of the times, especially during these pandemic times, even when we get a small kind of cough or sneeze, right, we tend to interpret it as some kind of symptoms of corona, and we think that we have got COVID-19, right? So this is what is actually there, and we'll be little more anxious about our own contact with others and all these things. So this is very common, but what is this when it becomes a serious illness or an anxiety disorder, right? So in this video particularly, we are going to talk about this illness anxiety disorder, which is more predominant in the medical student population, right? Because when they are reading through some kind of a disease or a disorder, no, they tend to read a lot of symptoms that can cause a particular disorder. So in that kind, they will be actually thinking that they have got all the diseases or all the symptoms that they are reading about. So this is very much predominant in the medical student society, but nowadays it has become more common with the usual population in the regular societies also. So let's see about this disorder. So in this particular disorder, what happens is there will be a kind of mild symptoms or sometimes even no symptoms also, but the individual will be misinterpreting the symptoms as they have got a serious illness, right? In case, for example, if they've got a common cold sometimes, and they can assume it as like, okay, they have got the COVID-19, right? Or sometimes the fatigue, that is the tiredness feeling that they are going to get through. So when they are feeling a body tiredness, then obviously they'll be thinking that they have got COVID-19 because their body is getting weaker. So all these are kind of misinterpretation of the symptoms, which is very much regular for them and very much common, but still during these times it seems to be more. But not only during the pandemic times, we have to be very careful about this, right? So not only during the pandemic times, but also regular times also, there are individuals who suffer from all these types of disorders, and this video is especially for those people, right? So we'll also know about what is this illness anxiety disorder. So when I'm actually discussing about this illness anxiety disorder, one more disorder is also coming up to my mind, that is the somatic symptom disorder. So if we see, there are a lot of similarities between the somatic symptom disorder and the illness anxiety disorder. Both of them are actually associated with some kind of anxiety in them, right? So but the difference is, like in the illness anxiety disorder, the symptoms will be a mild range, or sometimes it won't be there also, right? But in the somatic symptom disorder, the symptoms will be there, and sometimes the symptoms can even be more severe also, and they are going through some kind of a physical disorder or a physical disease. But the thing is that will be associated with the anxiety or distress. So this is a major difference between the somatic symptom disorder and the illness anxiety disorder. Now coming up to the similarities, as I told you, anxiety is predominant in both, right? And apart from this, what are the other symptoms when you ask me? The age of onset, like for example, it can occur in most common population, like for example, if it is going to happen for a teenage population, then it's more likely that the somatic symptom disorder can also be caused to the teenage population. And also the personality characteristics are more or less similar for these two people. Like when I say personality characteristics, it can be pessimistic or narcissistic, right? So if a person is always negative about thinking like everything happens to them, or negative things are only happening to them, or negatives are coming to their lives and all these things, then this can be actually common for both the somatic symptom disorder individuals and also for the illness anxiety disorder individuals. Okay, so these can be the similarities more or less. So there is this disease conviction that actually goes through in both of these cases. Okay, when I say disease conviction, it seems like the individuals think that they have got the serious issues in their body or serious illness in their physical symptoms are coming up and all these things. Okay, so this disease conviction is really very hard to break it, and sometimes the reassurance from the doctors, like they go for the doctor checkups and doctors will be telling them that they are all right, completely fine, and their bodily symptoms are all very common and usual also, they will not accept that fact, right? So in that case, multiple reassurance is needed for these individuals in order to believe that okay, they are all right, they do not have any kind of problem in their body or any kind of illness or diseases in their body, right? So this disease conviction goes through in both the cases, that is with the somatic symptom disorder and also with the illness anxiety disorder. So when we talk about the causes for this and the illness anxiety disorder, causes are actually the misinterpretations of the symptoms that they are going through. For example, even the heartbeat or the perspiration that they're getting, right? So when the heartbeat is a little more faster when they are climbing up the stairs, they might think that there's something wrong with their heart, and so they have to check their heart, some ECG has to be done, and all these things they will be going there in their mind, right? So this kind of misinterpretation of the symptoms is a major cause for this illness anxiety disorder, right? Apart from this, there can be other causes like the family connections or family contributions, right? For example, if the parents are thinking that things are happening wrong to them and they have gone through all these things and they feel that the situations or the events that are happening in their life are unpredictable or uncontrollable, obviously the children will also be learning that from their parents, right? So they will start learning that, okay, fine, so if this is happening, that is not controllable, so also they will be getting the disease or they will be having the illness. Since it's genetic, they might also get it. Like all these things will be going and running on in their children's heads, right? So they start acquiring the knowledge from observations from their family members, from their own parents also. So there can be genetic contributions also. And apart from this, there can be disorders in the cognition or the perceptions also. Like for example, when their cognition, when their thinking process is not normal and they start thinking so much pessimistic, that is all negatives about their lives and all these things, their cognition is faulty there, right? So that can lead to misinterpretation of the symptoms that they are going through. Or sometimes the perceptions, right? So the perception, if they are not viewing something in a right way and they are thinking that something is wrong with that thing that they are viewing, then obviously the perception is going to be wrong. So they tend to misinterpret those things and they think that they have got illness in their life, right? So this can also be one of the reason behind having this illness anxiety disorder. So these are the major causes for getting this illness anxiety disorders in the individuals. Now when we come to the treatment for this disorder, psychodynamic psychotherapies are available, and also these kind of reassurance and education that I was talking about. Like multiple reassurance has to be gone through for those people, right? So when I say reassurance, it can be both from the family doctors who are general physicians and also from the mental health professionals. So when it comes to the family doctors, they will be giving all the checkups and their reports, and they will tell their patients that nothing is wrong with you, everything is all right and all these things. But it's very hard for the individual to believe their family doctor. So in that case, they can go for the mental health professionals, wherein these mental health professionals, whatever reassurance they are giving, no, so that will be even more effective and also sensible for those individuals who are going through this illness anxiety disorder. So like for example, they'll be talking about the meanings and reasons for the symptoms that they are feeling. Like for example, if it's the heart rate, then why is that even more faster, or why is it even more slower? So why are they facing like this, and all that will be discussed in the sessions. So in that way, they will be thinking, okay, fine, so this is the reason behind it. So they will kind of understand and believe what the doctors or the mental health professionals are saying. So it is more or less effective when it comes to mental health professionals reassurance, right? And apart from this, there is cognitive behavioral therapy, that is CBT, right? So CBT is something which is challenging the illness related misinterpretations of the symptoms. If at all an individual is coming up and saying that they have got this headache regularly, and so they are assuming that they have got the brain tumor, right? So this is very common for those individuals. So when they are coming up with such an issue, then these CBT people will be actually challenging them that they have not got the brain tumor. If at all, if it's in a headache, so they will actually find out the major reason behind it, and they try to sort out it so that they will believe that it's not because of brain tumor, which is incurable or something like that, right? So these things will be happening in the mental health professional clinics. So that is to do with the CBT. So apart from the CBT, there is explanatory therapy, wherein the professionals will be focusing on the every details of the symptoms, right? Every meaning and details of each and every symptoms. So when they start explaining the symptoms, reasons behind it and all these things, the individual will start believing that, okay, fine, there's nothing wrong in their body, so they're completely all right, right? So that kind of thought starts blooming in their mind. So that is to do with the explanatory therapy. Then apart from these, if you actually see, the individuals feel that they have the physical symptoms, right? So they find it like, more of physiology than of psychology. So they rather prefer to go to a doctor and take up the medicines rather than consulting with a mental health professionals, because they feel that they are going through some kind of illness and only the physicians will be able to cure their problems, right? So in that case, what they do is they go to a doctor, and when the doctor finds it like this is just an illness anxiety disorder, they prescribe the placebo things, like they prescribe the placebo drugs. So when I say placebo drugs, it's like a common tablet, like it can be a nutrition additive component in their body, right? So sometimes it can be even vitamins or minerals that is even more good for their body, which is nothing to do with whatever symptoms they are going through. But the individual will believe that they are taking the drugs or the tablets just to reduce the symptoms and just to like cure these illness. So in that case, they will be misguided, but for a good cause, right? So that is this placebo effect. So sometimes the drugs can also be used. Yeah, it can be used, but most of the times these placebo drugs are actually prescribed to the patients. So this is how the illness anxiety disorder can be reduced or can be treated. So there we come to the end of this video with a different psychological content. I'll come and meet you all in the next episode. Until then, it's bye from Priyanka. Bye.